On the morning of Tuesday, March 13th, I was at work speaking with a colleague in my office, and all of a sudden I had a very warm rush from my head to my toes go through my body, and just kind of felt dizzy and like I was going to pass out. And I could tell that my speech was slurred, and she asked, "Are you okay?" And I looked at her kind of strange and asked, "Is my speech slurred?" And that's when she noticed my arm fell to my side, and she knew immediately I was having a stroke.
In the past, a patient like Deborah would have had to be transferred typically by helicopter to Atlanta or Augusta. And when it comes to large vessel occlusion or ischemic stroke, time is really of the essence. We know that even delays of a matter of minutes can make large impacts in the likelihood of having a survival free of neurologic deficit. So being able to provide those services locally, we hope made a big difference for Deborah, and we hope will make a big difference for other patients.
I had already lost a lot of my mobility. The left side of my body had been affected. And then after the procedure and starting to be in the recovery I came out of, I was able to speak, and my speech was clear again and starting to get strength back in my body.
The procedure that we performed is called a mechanical thrombectomy. It's an endovascular procedure, meaning that it's a procedure performed from inside the blood vessel. Prior to the advent of these procedures, a patient with an occlusion of the middle cerebral artery would, in many cases, be life-threatening. What these procedures they've taken really a horrible condition and made it where many of these patients can have a survival free of neurological deficit.
It's just amazing what technology is able to do, and it's a huge tool. And it's going to be a huge asset to the city of Athens in saving other people's life and making a difference in other people's health care.
Cities like Athens, 10 or 15 years from now, will all have access to these services, and I think we're just leading the way.
I can't say enough about Dr. Woodall. The Athens area is just so fortunate to have him as a physician here, and again, saving lives such as myself. Here I am, on week 5 from the stroke, and I'm walking between 1 and 2 miles a day.
My hope is that she'll return to living a normal life with her family and working, and really this being a bad memory at some point in the distant future.